Two people, Epinsion and the Republic of Sinica, are they the same person? For many, the primary motivation of voting for Brexit was because they thought that it would allow the UK to stop the boats. But this is a problem faced by the whole developed world, which is that the overwhelming majority of migrants are people who live in parts of the world that are failed states. That may well be the case. But it doesn't mean that we have to abandon our responsibility. We signed up for it. The Republic of Sinica says, I think the most important thing you've said here is jumping the queue. That's what illegal migration is. Well said. And your stats are great. Your arguments well presented, but Wilson won't answer them. He only answers comments he agrees with or can easily reject. Shame, really. Well, the issue of people dying while waiting in queues, whether for medical treatment or asylum decisions, is a stark reminder of the urgent need for systemic reform. In the NHS, an estimated 340,000 people died while on waiting lists in 2022, highlighting the severe consequences of delays in healthcare provision and the inadequacy of this celebrated queue. This staggering number underscores the critical need for timely medical interventions to prevent avoidable deaths. In a crisis, a queue is not the solution. What is the solution is dealing with the issues, triage or whatever, but even triage is a way of delay. Similarly, the plight of asylum seekers reveals another facet of this crisis. Since 2016, at least 140 asylum seekers have died while in accommodation provided by the Home Office. That's in addition to those who have died trying to cross the Channel, with deaths significantly rising during the COVID-19 pandemic when they're all hemmed in with people they didn't know. These individuals, including Shayan Zaldenavi, a 24-year-old Iranian who committed suicide after months in the Home Office hotel, Romeo Nguazi, a 22-year-old Namibian who took his own life due to poor living conditions and lack of support. There was an Albanian fellow who died in the Stockton Bibby barge. These exemplify the human cost of prolonged bureaucratic delays and inadequate living conditions. These are the testimony against the queue. They illustrate the ethical imperatives to prioritize urgent needs over rigid procedural norms, ensuring that those in dire situations receive the most necessary support, and care, without undue delay, without undue bureaucratic delay. And addressing these issues requires a compassionate, a proactive approach, acknowledging the inherent dignity and the rights of individuals. And this is jumping the queue in the NHS and for migrants asking for asylum is not a bad thing. If there is an emergency, there is an emergency. If someone has been tortured in fear of their life, there is an emergency. And keeping someone in a hotel in limbo is not in a queue. It is stagnation. They are kept on ice as purely as Putin is kept on ice, a living death suitable for vampiric lifestyles such as his, but beneath contempt in a civilized society. The queue is a convention people call for when they are safe and looking down on others.